Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Cystitis and its types. So first we look at the interstitial cystitis. So the interstitial cystitis. So the etiology is it is idiopathic, and the characteristic feature is the Unner's ulcer. Unner's ulcer. Next we move on to the polypoid cystitis. Polypoid cystitis. So this etiology is nothing but the catheterization of the bladder. So catheterization of the bladder, and the characteristic feature is it mimics the malignancy. So it mimics malignancy. Then we look at the malakoplakia. Malakoplakia, it is a defective phagocytosis. It is a defective phagocytosis. And the characteristic features, it includes the Michaelis-Guttman body. So M for M, that is Michaelis-Guttman bodies. Next we have the eosinophilic cystitis. In eosinophilic cystitis, the etiology is the systemic allergic disorders. Systemic allergic disorders, and the characteristic features is it includes the submucosal eosinophils. Then we look at the emphysematous cystitis. So under the emphysematous cystitis, the etiology is the Clostridium perfringens. And the characteristic feature is it is associated with the diabetes. Next we look at the follicular cystitis. In the follicular cystitis, the etiology is there is prolonged urinary retention, and the intravesicular chemotherapy. Intravesicular chemotherapy, or there is presence of the BCG. Now what are the characteristic features? Characteristic feature is that there is lymphoid follicles. There is presence of the lymphoid follicles, and this is within the bladder mucosa. Within the bladder mucosa. And lastly we move on to the hemorrhagic cystitis. Under the hemorrhagic cystitis, there is presence of the cyclophosphamide. So etiology is cyclophosphamide, as well as there is presence of the BK virus and also the adenovirus. So what are the characteristic features here? The characteristic features, it includes the prophylactic administration of the Mesna. So prophylactic administration of Mesna, and it reduces the incidence. To learn and grow daily like this, please do subscribe.